You came into contact with something that made your skin crawl, though you didn't know it at the time. Later, you noticed that your skin responded in a dramatic way, for you are now sporting an unsightly rash. It's contact dermatitis. Contact dermatitis is a skin inflammation that occurs after physical contact with an irritant or an allergen.
There's a variety of causes of contact dermatitis. One of the most common ones is poison ivy, but there's also different chemicals that we're exposed to in our daily living that can cause skin inflammation, such as hair dyes, nail polishes, metals, such as nickel in costume jewelry or buttons of jeans or pants. But there's, many chemicals that can cause contact dermatitis.
A contact dermatitis rash can vary in appearance from person to person. It's usually red and itchy, sometimes with bumps. A severe reaction can cause fluid-filled blisters. You can also experience swelling, burning, or tenderness. If you've never had contact dermatitis before, you'll wonder what horrible thing could have caused your skin to react this way. It might not be horrible at all, but something you've had sitting in your house for a long time.
So a lot of people are shocked to know that you can develop an allergy or an irritation reaction to a product that you've been exposed to for a prolonged period of time. It may just be that the skin is irritated for some unknown reason, and then when exposed to that irritant or allergen, it develops this irritating rash.
The most important part of treating contact dermatitis is determining the cause. If it was a one-time contact with something you're unlikely to encounter again, like poison ivy, great. You can treat it with a topical corticosteroid or soothing moisturizers and move on with your life. If it's happening regularly, then more needs to be done.
So you'll have a history of somebody going to get their hair dye or their nails painted, and a few days later they'll start to be itchy or have a rash. Specifically in the eyes, we sometimes see swelling of the eyelids or around the mouth. And it really takes the history to try to pinpoint what exactly the patient did that caused them to rash. It may be they got a new piece of jewelry, they got a new piece of clothing, again, the hair dye or the nail polish, and then you kind of have to put back the pieces of the history to try to see what causes that rash.
Using a history can help narrow down the allergen possibilities, but the exact allergen can be determined with something called a patch test. During a patch test, a tiny amount of common allergens are applied directly to the skin.
The one we use in our office can test up to 70 chemicals that are found in daily products that we use on a routine basis in shampoos, soaps, lotions, detergents, products that are found in leather or in dyes and clothing. And it kind of mimics the irritation that they experienced when they used whatever product it was that caused their reaction. And we're able to assess in that small area where we put the allergen, if they develop a rash, we can kind of put everything together and tell them to avoid that product going forward.
The first form of treatment is soothing the current irritation. This could include a prescribed corticosteroid, moisturizers, or soothing agents like calamine lotion. After that, avoid the allergen as much as possible.
That is the only treatment, avoidance. I generally tell my patients to maintain good hydration of the skin, because the better the quality of the skin, the less likely it is to be irritated. But yes, the only treatment of contact dermatitis is avoidance of the irritant or the allergen.
Avoiding your allergen can involve some effort and sacrifice. You may have to throw out all your old soaps and find new products that don't contain your allergen. If you're allergic to the metals used in jewelry or in clothing, then you can create a barrier by applying tape or clear nail polish over the areas that will touch the skin. You can wear protective clothing or gloves when you can't avoid the allergen, such as when you're using household cleaners. It might be a lot of work at first, but soon you'll have new favorite soaps, plus clear and happy skin. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay healthy.